very good day, I bid to Dr. Arifa. We are from Group 1 and today we are going to present about Nsaids. So first of all, I'm going to start off with Nsaids classification and example. So Nsaids can be classified with two methods. The first one is the mechanism of actions, effect towards the cyclooxygenase 1 and cyclooxygenase 2 enzyme. Secondly, we can also classify them by their chemical compound, which is carboxylic acid group and enolic acid group. So for our group, we are going to divide these Nsaids based on their chemical structure and selectivity. So first of all, the analgesic, antipyretic with poor anti-inflammatory Nsaids such as acetaminophen, and preferential selective COX inhibitor. We have the examples of nimesulide meloxicam, nebumeton. Thirdly, the non-selective COX inhibitor. We have salicylates, aspirins, propionic acids such as ketoprofen, ibuprofen, carprofen, indomethacin, piroxicam, mefenamic acid, and also diclofenac. Lastly, selective COX-2 inhibitor such as rofecoxib and celecoxib. So that's all from me, and I will pass to my group mate for the next component.
Okay, hi everyone. I'm going to continue about the clinical use of non-steroidal anti-inflammatory drugs. So for the first point, the Nsaids can be used as antipyretics that can inhibit the prostaglandin synthesis. The thermostat will be reset to normal and the body temperature will be lowered down by increasing heat dissipation due to peripheral vasodilation and sweating. Then, Nsaids can reduce the body temperature in fever states associated with microbial infection. Last but not least, Nsaids may encourage an earlier return to normal drinking and eating pattern, and therefore aiding the recovery of the ill animals. The second point is, Nsaids can be used as anti-inflammatory drugs. As I said before, this drug can reduce the prostaglandins secretion or synthesis, which mainly derive from COX-2 that play a significant part. These include the vasodilation and edema of inflammation because vasodilation facilitates and potentiates the action of mediators that increase the permeability of postcapillary venules such as histamine.
The third clinical usage of Nsaids is it helps in reduction of pain perception and diminish postoperative surgical pain. For example, Nsaid is given as an analgesia to relieve chronic pain in cases that are associated with cancer. Next, it is also commonly used in veterinary field to relieve inflammation pain, such as in dogs, it is given for osteoarthritis condition, whereas for horses, it is given to relieve pain from colic, navicular disease, and laminitis. Thirdly, Nsaid is also used as an alternative to opioids. Nsaid is as effective as an analgesia like opioids to control perioperative pain. It is also a long-acting drug and it doesn't possess side effect on CNS like opioids. That's why it is generally used as an alternative to opioids and also to extend duration of analgesia which was initially initiated by opioids.
Everyone, and I will explain on the adverse effect of Nsaids. Before we move on to adverse effect, let me explain more briefly about the mechanism of the Nsaids. So the Nsaid inhibits cyclooxygenase COX enzyme will lead to the decrease of the production of the prostaglandins. Nsaid also inhibit the formation of arachidonic acid, and arachidonic acid is the one who is responsible for the production of prostaglandins, and thus the prostaglandin will not be produced. The COX pathway also maintains the homeostatic process, including moderation of the renal blood flow and pellet aggregation. So let us move on to the adverse effect of the Nsaid. First is coagulation. Nsaids such as aspirin and ketoprofen will have negative effect on coagulation. Pellet aggregation is caused by prostaglandin and thrombosins, which are produced by platelets using a COX pathway. So since NSAID inhibit the cause pathway, and inhibition of the cause pathway will cause bleeding. Second will be the cardiovascular. Decrease the production of the prostaglandin, which is responsible for vasodilation and antithrombotic substance, without inhibit the vasoconstriction, and thrombosin A2 will increase in the blood pressure. And inhibition of the prostaglandin production causes an increase in vascular tone, blood pressure elevation, thrombogenic state, and likely arteriosclerosis. And now I will pass on to my teammate Alicia. And
Next, gastrointestinal also involved in the adverse effects of NSAIDs. Well, NSAIDs are believed to inhibit gastric COX-1, which synthesize prostaglandins that normally inhibit acid secretion and protect the mucosa. The symptoms typically include gastric discomfort, constipation, nausea, vomiting, and some gastric bleeding and ulceration. Besides, NSAIDs can also cause renal effects. In therapeutic doses of NSAIDs in healthy individuals pose little threat to kidney function, but in susceptible patients, they can lead to acute renal insufficiency. This occurs due to the inhibition of biosynthesis of prostanoids involved in the maintenance of renal blood flow. This inhibition of prostanoid synthesis causes the retention of sodium and water, edema, and hyperkalemia. And the last one is skin reactions. Well, rashes are common distinctive unwanted effects of NSAIDs. They vary from mild erythematous, urticarial, and photosensitivity reactions to more serious and potentially fatal diseases include Stevens-Johnson syndrome in humans.
The majority of NSAIDs are administered orally. NSAIDs are weak organic acids and are therefore absorbed rapidly in the stomach and intestine. The stomach has lower pH than the small intestine, and therefore more drug is in the inionized form. The main source of absorption in the small intestine is due to its large surface area. However, the rate and extent of the absorption is differs in species, the gastric pH, dosing in relation of feeding, and gastrointestinal motility. These drugs also have high bioavailability due to limited first-pass hepatic metabolism. NSAIDs are highly protein-bound molecules which cause displacement of other protein-bound medications, leading to increased free drug concentrations and increased risk of adverse effects. NSAIDs primarily undergo hepatic metabolism and metabolites excreted in the urine.
Before we talk about the mechanism of action of NSAIDs, let's first find out what exactly is the cyclooxygenase pathway and what is COX-1 and COX-2. When there is a tissue injury, an enzyme called phospholipase A2 is released. It acts on the phospholipid bilayer of our cell membranes and releases arachidonic acid. Arachidonic acid is a polyunsaturated omega-6 fatty acid, but it is not an essential fatty acid. It's present in the phospholipid portion of the lipid bilayer in our plasma membranes. So this arachidonic acid undergoes a pathway called the cyclooxygenase pathway. Cyclooxygenase itself is an enzyme, and there are two types. There's COX-1 and COX-2. COX-1 is related to normal bodily functions and homeostasis, and it also related to thromboxane and prostaglandins.
Okay, now we know the types of cyclooxygenase enzymes. So generally in NSAIDs, the inhibition of cyclooxygenase 2 will produce the effectivity of the NSAIDs. So the inhibition of cyclooxygenase 1 will produce the side effects. So as NSAIDs such as aspirin and Tylenol are non-specific NSAIDs, so they block cyclooxygenase 1 and cyclooxygenase 2. The NSAID drugs nowadays are cyclooxygenase 2 specific inhibitors. So they will block the cyclooxygenase 2, which blocks the production of the prostaglandins. So when they block the prostaglandins production, it will produce a generation of heat, which produce the mild analgesia effect. Okay, when they block the cyclooxygenase 2 enzymes, they will also block the formation of leukotrienes. The leukotrienes are formed on the lipoxygenase pathway, where the arachidonic acid converts under the lipoxygenase enzymes to produce leukotrienes, and leukotrienes activates the leukocytes. So when the biosynthesis of leukotrienes and prostaglandins are blocked, then the NSAIDs will able to produce the anti-inflammatory, antipyretic, and analgesic properties.